The self-inflating bag delivers only room air, 21% oxygen, unless the bag is joined to an oxygen source. How much oxygen does a bag valve mask deliver?
The self-inflating bag delivers only room air, 21% oxygen, unless the bag is joined to an oxygen source. At an oxygen inflow of 10 L/min, pediatric bag valve devices without oxygen reservoirs deliver from 30% to 80% oxygen to the patient.
To deliver consistently higher oxygen concentrations, 60% to 95%, all bag valve devices used for resuscitation should be equipped with an oxygen reservoir. At least 10 to 15 L/min of oxygen flow is required to maintain an adequate oxygen volume in the reservoir of a pediatric manual resuscitator.
For the larger adult manual resuscitators require greater than or equal to 15 L/min of oxygen flow to reliably deliver high oxygen concentrations.
You are right. The masks themselves can come in a range of sizes and designs depending on whether the patient is an adult or a child, a large or a small person. How can you select a bag and mask of appropriate size?
The mask must be able to completely cover the victim's mouth and nose without covering the eyes or overlapping the chin.
The cuff around the mask is commonly inflated with air or made of a firm sponge-like material which is designed to mold firmly around the patient's face. They are independent of the bag and can be easily separated from it and replaced if necessary. It is important.
Preparation. Preparation. Preparation.
The key to being able to bag the patient effectively relies on some important preparation.
I know from my experience. Firstly, we need to consider the position of the patient.
One moment. If you're a patient with multiple trauma,
if no signs of trauma are present, tilt the victim's head back to help open the airway. If trauma is suspected, do not move the head. To open the airway of the victim with trauma, lift the jaw.
This technique of opening the airway and sealing the mask to the face is called the EC clamp technique. It is important that the facial plane should be parallel with the ceiling, as hyperextending the neck may make the view more difficult and ventilation harder.
The ear of the patient should be level with the sternal notch in order to ensure that the plane of the mouth.
Once you successfully apply the mask with one hand, compress the ventilation bag with the other hand until the chest visibly rises. Can we continue this later?
Yes, of course.